What happens if you're diagnosed with oral cancer? It's a tough question. It's a tough topic. We need to have more open communications about these kinds of things. So let's start at the very beginning. You have or know someone who has a funny looking lump or bump on the side of their tongue, under their tongue, inside their mouth. Many times your dentist or your hygienist would be the first person to see that, but if it's something that's bugging you, definitely want to get that checked out as well. We many times will get that referral from the general dentist to say, hey, can you please look at, evaluate, and treat this lesion? And what I will do in that sense would take a biopsy, and that is usually something that I will do. We'll send that to our oral pathologist, who then will give us more information. What happens if it does come back as oral cancer, squamous cell cancer? In those situations, what we're going to do then is that we're going to work with one of these tertiary centers who then will have a team that can take care of you. I can't speak for those teams because they'll look at what happens and they'll take scans and get much more information to make their decisions, but here's a rough idea of what would happen there. Most oral cancers are going to be first and primarily treated with surgery, which is a little bit different than other cancers. Different cancers might benefit better from chemotherapy first. Other cancers might benefit from radiation therapy first. But these types of cancers in the mouth generally tend to be treated first with surgery. Now, what would happen if surgery doesn't fix everything? Or what if there's spread into lymph nodes and things like that? Or if there's something that it may be very difficult to get all of the cancer out surgically because it's next to important structures and nerves or blood vessels. Then in those situations, then we rely on the hematology oncology team and the radiation oncology team to come up with adjunctive therapies, including chemotherapy and radiation, to perhaps kill cancer where the surgeon can't get to it. Now, the other part of this too is that, hey, we can go ahead and cut out cancer, right? But then that's a pretty debilitating thing, especially in the head and neck region. And so we want to be able to do some kind of reconstruction. For example, if you have cancer on the side of your tongue and we go ahead and do a hemiglossectomy and take away a big portion of your tongue there, you still want to be able to talk and eat and things like that afterwards. And so now we have to talk about, hey, how are we going to reconstruct your tongue? And there are really awesome modalities that these surgeons and these scientists have come up with, including things like bone grafting and skin grafting for smaller issues, but also some bigger ones. Hey, maybe we need to replace the tongue with some muscle tissue. And so we can do things called free flaps, which are basically saying, hey, we're going to go ahead and take a portion from over here and then transplant that over there. It's fascinating stuff. It's very intensive and, again, very specialized, and which is why someone like me who doesn't necessarily have that training will then defer those big cases over to a tertiary team in this area.